scratch card. 3 games, 16 chances to win. Win with a top prize of $125,000. Unbelievable but true. It's the new $10 scratch game. $125,000 jackpot. Loaded with lots of cash prizes. $100, $1,000, $10,000, and $125,000. Get your ticket from any lotto agent or scratch runner. $125,000 jackpots. There's cash to catch with just a scratch.
Good evening and welcome to this week's edition of Roundtable Talk. As you know, the nation's schools will reopen at the end of this month, August 31st to be exact, after a long break due to COVID-19. To talk about the new protocols and what's going to happen when that happens, we have with us in studio this evening Permanent Secretary in the Ministry of Education, Myccle Burke. We also have the Chief Education Officer in Elizabeth Walker, and we have Health Promotion Officer in the Ministry of Health, Wellness and the Environment, Shanika John, with us to talk all about that. So tell us what's happening. Some protocols have been developed to facilitate the smooth transitioning of the reopening of the schools. What are the main provisions where these protocols are concerned? I don't know if you want to start with that as part of the team that has in fact been working on that aspect of the transition.
Okay. Good afternoon, everyone. So we, from the Ministry of Health, Wellness and the Environment, we have been in constant discussion, collaboration with the Ministry of Education, and we actually started to provide some guidelines from early as probably March, April, May, June, and we kept revising and updating them. At that particular moment, we were at a different stage with COVID-19, and so I think that resulted in us doing, for the last semester, the staggering of classes, specifically for those students who have to take their exams, and education can talk more about that. With the reopening of schools for the new school term and for this new school period, the Ministry of Health has recommended some specific guidelines that we have shared with the Ministry of Education and has asked for it to be implemented in schools to ensure that our teachers and our students are safe. A lot of them are still very general precautionary guidelines. Specifically now we're asking that the children, staff, which would include teachers and principal and other workers, that their temperature be checked and recorded upon arrival at school. It's still up to schools or the Ministry of Education to decide whether or not this is done upon entry, as arrival at the gate, or whether or not this is done within a specific period or in the classroom session, etc. The Ministry of Health, we've recommended that it should be done at least once per day. We recommend that it is done very early in the morning in the event that we have to make any further assessment on that child or staff, etc. There are some other recommendations. We also recommend that for students who are taking public transportation en route, that they wear a face covering of their choice, whether it be a cloth mask, a shield, or a bandana, anything that is appropriate for this journey. And when they get to school, that this can be removed, as they will now enter what we classify our version of a Vinci bubble. So the school is classified to be one of their primary bubbles during that period.
Okay, we could probably come back to the individual things that you've spoken about at a later date. But from the Ministry of Education standpoint, how ready are we for the reopening in the next couple of days? PS?
Okay, good afternoon, everyone. Readiness is more conceptual than actual. Very subjective. What we may see as ready, the public may see differently, or certain fractions of the public will see differently. But we're working assiduously to put in things in place for August 31st, because August 31st, schools will reopen. That has been decided, and we're working towards that. Now, based on the protocols provided by the Ministry of Health, one of the main things that needs to be done is the temperature checks. Now, when this was communicated, we put it out there, and we were able to receive funding from different sources. We saw the generosity of our people as well too. So organizations, entities reached out to the Ministry of Education and communicated desire to assist. Some organizations such as Vinci Cares reached out almost immediately and made a commitment to provide in excess of 100 thermometers. Now for the viewing public, we have a total of about 68 primary schools and 27 secondary schools. So 100 thermometers would be adequate to start. But we've gone beyond that as well. We have engaged UNICEF. We have engaged POWER as well. And they will provide a quantity of about 1,000 thermometers to be used in the schools. And we're working to ensure that these thermometers are procured expeditiously.
But for that, you do have enough to ensure that...
for the commencement, yes. Yes.
What would you say to parents who are in fact reluctant to send their children out to school on August 31st?
All right. I would speak to them as a parent, because I'm the father of two. And I know the perils, the challenges that face parents in managing children from a distance. Children are eager to get back out there. Now, once the Ministry of Health articulated the concept of the bubble, the aim is to ensure that what is outside stays outside. What is inside is safe. So parents, speak with your children. Provide them with what is necessary to ensure that the concept of a bubble is maintained, that the school environment is a clean environment, a COVID-free environment.
Let's talk a bit about the bubble. What exactly is involved here when we talk about a bubble within the school environment for the purposes of?
The bubble concept is something that we have been advocating for in different settings. So particularly for the school, it's not a new concept. Your bubble is classified to be an area where you would spend a prolonged period of time and the people that you would interact with. And in that particular bubble, you would know who exists and their risk of exposure or any other factors that would be considered important in this bubble. It's not an ideal bubble because like the basketballs and all of these have these, nice fancy bubbles. So that's why I said it's a Vinci version bubble. So in this bubble, the children are within this particular space, within this particular institution, under specific care by their teachers. And all the Ministry of Health we're asking is that for teachers, principals, for the staff to meet us just a little way in terms of the detection of any sort of flu-like illnesses like COVID-19. The temperature check allows us to have that early detection. So right away we will be able to detect whether a child's temperature needs to be flagged, which is about 100.1 in Fahrenheit and about 38 in Celsius. So all of this, the health promotion unit, we're doing training with principals and teachers. We actually started already this week. Tomorrow I'll be in Beckway, and I'll do that session with the principals and teachers of the secondary and primary schools, and even the preschools as well, who have offered to be a part of it to kind of discuss it. So in that bubble, the students are taken care of just as they're taken care of on a regular, normal basis outside of COVID. The only introduction to it is the use of the temperature, which is the non-touch thermometers to check their temperatures. We ask that the principals and their management team advise that if a student is sick or a teacher, staff member is sick, that they should not report to work, especially if they're experiencing flu-like symptoms. So that is still in place, and we ask for strict compliance. So even in the bubble, you have to limit the number of people who come into that bubble and the interaction in that bubble. So at this point, schools are going to start to have to consider who they let on the compound and for what purpose. And this is going to have to be a discussion. So you may have to limit the number of visitors. I know for the primary schools, when we met on Monday, some of the kindergarten children had teachers had some concerns in that, parents want to stay with their child and interact with their child. And this is something that they're going to have to now consider, whether you limit the time or you develop a system that allows for the child to go directly to the classroom. Whatever it is, the schools are going to have to now discuss this concept. Even in the bubble, we ask that you limit the number of access points in and out of the school so that no one could actually just walk onto a school or be allowed to just exit a school. So it means that you may have to monitor more of your entry points as well.
So there's a home bubble and a school bubble.
Yes.
So what are the synergies between these two bubbles?
Well, even at home, we're asking for parents, and this is going to be important in when they have their first PTA meeting as well for discussions. And this is where the health promotion unit will come in, along with the family nurse practitioners, to sort of get parents involved in this process. You're going to have to play a role as well in terms of monitoring your child. And this is one of the reasons why for the en route journey, which is either public transportation, etc., we advise that they wear a mask. Because we're still in a pandemic, we're not COVID-free, and we know that if anything, they need that sort of protection. So at home, we still advise that parents keep a thermometer. It doesn't have to be a non-touch. It could be one of the regular ones at the pharmacy, and monitor their child. One of the things is that we ask that it be recorded. And this record could help us in terms of the detection. So we may notice that the ministry may flag a child on Friday who has a temperature of 100.1. But when we check the record, we could see that there was a slight progression in that child's temperature, which could very well be very useful for us in our contact tracing point.
So the monitoring of the temperature is one of the critical...
For early detection.
Oh, yes. Mm-hmm. And it's going to be one of the very important protocols when schools reopen. Who exactly will be doing the temperature monitoring in school? And secondly, do you think there might be a possibility of assisting some homes with thermometers, if necessary, somewhere down the line, so that they can do their own thing in their home bubble?
Who would be doing the checks? We've heard recommendations for health professionals to do the checks. What the Ministry of Health has recommended, however, is that persons who are trained can administer the tests. We cannot mandate any teacher to do this, but we would say it would be in the best interest of yourself, your school, and the students if teachers can volunteer to assist with the checking. We want for the checks to be done at the entry points. We want for the checks to be done early upon arrival, because we're working towards ensuring that a safe environment exists within the compound of the school. I see you looking at me. You're looking at me with eagerness. And that look on your face is saying that how has the Ministry of Education designated anyone to do the checks?
Thanks for preempting me.
And
yes.
then I reiterate that we anticipate and we know our teachers. We know the commitment of our teachers. We know that our teachers are sincere parents and sincere teachers. And we know that come August 31st, this question will be answered in action.
Have you prepared for if it's not answered in some cases?
We're trying to weave that into our protocols, but the chief can expound.
Good afternoon. Education is our business. It's the responsibility of a particular ministry, and that ministry is the Ministry of Education. It is important that students return to the classroom. We have assessed the period between April and now in relation to students' engagement. Some students have not engaged in any learning activities since April. And we are concerned about these students. We would have been engaged on the online, and we would have assessed that. Online learning, teaching and learning cannot replace face-to-face. The research has shown that. Hence, it's important that students return to the classroom. If they do not return now, when will they return? When we look at the statistics presented to us, and we are indeed guided by the Ministry of Health. We have engaged the principals. We are continuing to engage principals. I've said to my senior education management team to be close to their respective schools. It is an anxious period. Everyone is concerned. We have never experienced it before. So it's a learning experience for all of us. We cannot expect the ideals. However, we think and we feel comfortable at this point to return to the classrooms. And the senior education officer will work with principals. And as I have said to the principals, the coalition of the willing. There are persons, teachers who have been reaching out to us, principals who have been reaching out to us, and we are working to ensure that we would find teachers and we would find other staff members, parents who can assist in ensuring that students continue the learning process in a face-to-face environment.
We can talk some about that when we return from our first break, and there are a couple of questions that we'll answer when we come back. Don't forget that you can submit your questions, comments, and concerns, and our panel will be pleased to answer them for you. Back in just a moment.
Channel 114. Visit you. Channel 114.
1 scratch card, 3 games, 16 chances to win. Win with a top prize of $125,000. Unbelievable but true. It's the new $10 scratch game. $125,000 jackpot. Loaded with lots of cash prizes. $100, $1,000, $10,000, and $125,000. Get your ticket from any lotto agent or scratch runner. $125,000 jackpot. There's cash to catch with just a scratch.
Welcome back. Before the break, you were talking about the importance of having children return to the classroom. But in between all of that, we have gotten a couple of questions. The first is, how many times a day will they be taking the children's temperature? Another person wants to know, what about teachers with underlying health issues? And someone else wants to know, what are the protocols for preschoolers? Yeah, so who wants to take which?
From the Ministry of Health, the recommendation that we propose is that the temperature should be taken at least once per day. And we recommend that it be done very early in the morning, and that would allow our team to respond early in the detection process so that we could make an assessment as quickly as possible. So once daily is recommended and very early.
Okay. So that would almost become like a daily routine before school?
Daily routine. And this is during school.
Okay. All right. Teachers with underlying health issues?
GP could jump right in.
The protocol that existed before COVID obtains where the teacher is sick, the teacher goes to the doctor, the teacher receives medical leave, the teacher submits that to the Ministry of Education, and we will just follow through on what our protocols were before in relation to teachers' illness, general illness. If there are other areas of concern outside of that parameter, that can be discussed with the Ministry of Education. We are open. We are here to support our teachers, and we can discuss.
Okay, the protocols for preschoolers?
We met with the team from the Preschool Association, and the guidelines would be guided by the same guidelines that was sent from the Ministry of Health in relation to how they function as well.
Okay, and someone else wants to know, are there plans to engage in sensitization of parents and guardians about the way forward with COVID-19 and face-to-face learning?
Again, we met with the principals, and we said at that meeting it is important for principals to have their Parent-Teachers Association meetings early. We were heartened by the fact that during the online period, principals reported greater attendance at the virtual principals meeting. So no better way to engage the parents, to hear from them, to guide them, as they have been guided by the Ministry of Education and the Ministry of Health in relation to how they can support their children during this period.
So I know I heard the Minister of Education stating that the Ministry of Education is in fact providing support to teachers and students to ensure the smooth transition in back to school. What kind of specific support is he referring to in the case of each of these groups?
Resources are limited, financially and otherwise, but available resources would be provided to teachers and students. The Prime Minister has communicated in no uncertain terms that even schools that are privately owned, preschools in particular, are to be provided with available supplies. So they would visit the Ministry of Education, they would speak with our storeroom officer, who would make available cleaning supplies and other things. As I said before, we're endeavoring to procure a quantity of additional masks to be distributed as well. This distribution is not just for government-owned schools, but for private schools as well too. Again, we're looking to effectively manage the available resources in terms of what happens at the schools as well. There would be an increase in ancillary staff. So a decision was taken to employ more cleaners where necessary. A decision was also taken to employ more security guards, more security officials where needed. And we're working with the principals of the different institutions to complete this task.
Okay, someone wants to know whether or not preschoolers would be required to wear masks as well.
According to the protocols, all students commuting, it is strongly recommended that they wear a mask.
Let's talk about, you mentioned commuting, let's talk about transportation to and from school. What entails here?
So for the students who are taking public transportation to and from school, we recommend that for them and their parents or guardians, they wear a mask or face covering. And like I said, there's a face shield or etc. During that process. So ideally, we would recommend that a child should have at least 2 cloth masks that they could use. One that they would use on their way to school in the morning. They change when they get to school, put it in their bag in a secure place. And then another one that they would use for afternoon. One of the reasons why we did not recommend for the use of masks during school is that because we actually realized we are more concerned about the contamination, about students wanting to swap masks, character masks, because yours were cooler than mine, persons not being able to wear them properly in the forehead, under the chin, swinging with children, etc. So that was also part of our thinking, and also within the context of which. So during that period, we ask that they wear a mask. And then once they get to school, that mask can be removed.
So it's going to be important to sensitize all the kids about the proper use of their masks, etc., etc.
And this is really to preserve their bubble. So their home bubble is considered one instance, and then the school bubble and any other interaction, you really want to preserve and secure that area as well.
The whole question of transport to and from school, I noticed the protocol is suggesting that hand hygiene protocol on entry and exit of all public transportation is also recommended. How is that going to be monitored? if at all?
We do recommend, and at this point, this is where we're asking the parents to actually have a shared responsibility in this, that you have a child or children traveling to school. You can ensure that they have, whether you want to do a hand sanitizer that has 70% or more alcohol contents in it, that they can use before and after they leave the bus, local public transportation. Once they get to school, they can practice using liquid soap and running water. And the hand sanitizer is really in the absence of. What we have been pushing from the health promotion unit is specifically to ask children to keep your unwashed hands out of your face. Your eyes, your nose, your mouth. We know that is difficult, but once we can get children to have that practice, so your hands must be clean before you can interact with any part of your body. And even outside of COVID, this is something that we tend to advocate for as basic hygiene practice. So that is something that we're asking parents as well in the monitoring of the bubble from home, that there are some essential items that you will have to include, and that conversation has to be ongoing with your child or children.
I know we are saying that the public transport should also be properly and frequently sanitized, but who is going to be policing that to ensure that it does in fact happen?
Well, I think they already have a system in place that actually monitors that process. And I think for a lot of the public transportation, the buses, etc., they are actually fined, if anything, subject to correction, if they don't comply. I know that was in place. I'm not sure if it has been relaxed, but it is something that I know is ongoing as well.
So the police will be policing.
Thank you.
The police will be policing. Okay, so on arrival at school, what happens? You know, we go back to school, what happens on arrival? What updates?
So the Ministry of Health, we're recommending, and if we go back to the person who had asked the question about teachers with underlying condition, this is part of the reason why we're asking for the temperature check. It's not just for the student, but it's for everyone. And this is going to help in the detection and the management of persons who may be at risk for developing COVID-19, because it will help us to detect early, and once that detection happens, then we can manage, treat, and then we can control, which we have been doing for all of our cases so far. So upon arrival, the Ministry of Education will circulate to the principals, etc., in terms of whether the temperature will be checked at the gate or during the class time, whatever the system is. So students get to their class, we ask that there be no general gathering. So I think this semester there is no assembly, there's more class assembly, class announcements, etc.
What about sports? Will there be sports?
Yes, there will be sports.
Okay.
So I think, so the students go to their class and they report to their teachers in the event that they are not feeling well. Teacher can detect with the temperature, and they can also do some other assessment outside of COVID. It doesn't have to be COVID. Maybe a child may not generally be feeling well. This is an opportunity for that sort of care.
Somebody wants to know, education about the proper use and wearing of masks is what is important. What happens to a child who is asymptomatic? He protects the passengers on the public transport, but infects his classmates and teachers?
So in that particular case, if a child is wearing a mask, because based on what they're saying, the child protects himself and the other persons on the bus. But when they get to school, their temperature is checked. And even if they are asymptomatic, you will get a progression over a period of time with the temperature, and that has been proven. And this is why, for one of the requirements for the reopening of school, that we have given that specific context. And we also have to pay attention to our local context in St. Vincent and the Grenadines. 100% of our cases are imported or import-related. And even when we have done further testing and further screening in country, we have not been able to detect anything community spread, any local transmission, which we have been seeing across the region globally as well. So with that evidence in mind, this is why we are not saying go back to normal, carry on with your life, we're in the middle of a pandemic. So all the basic precautionary measures must still be in place. But if a child is suspected to have COVID-19, you will be able to detect and pick up any sort of progression with the virus if we continue to do the temperature checks early. So we test a child on Friday, like I said before, etc.
Okay, before we take our next break, someone is saying that teachers are not nurses and should not be conducting temperature checks. I think I lost that one. There should be an assigned nurse or nurses based on population to the schools. We know that that's impossible with the limited resources that we have in this country. So, you want to respond in any way to that?
Again, I reiterate the limitedness of resources.
Have to be
And
practical.
the Ministry of Health has communicated in the protocol that persons can be trained to administer the checks.
Which is what
And
we
they
have
have been-
started.
and
We have
they have
started.
started.
Started that process as well.
Okay. When we come back, we'll answer the next question that I just saw come up on the stage. We'll be back in just a moment for our third segment.
And 114. Visit you. Channel 114. Visit you. Channel 114.
One scratch card, 3 games, 16 chances to win. Win with a top prize of $125,000. Unbelievable but true. It's the new $10 scratch game. $125,000 jackpot. Loaded with lots of cash prizes. $100, $1,000, $10,000, and $125,000. Get your ticket from any lotto agent or scratch runner. $125,000 jackpots. There's cash to catch with just a scratch.
Before we took our last break, we were responding, in fact, to somebody who was suggesting that there needs to be nurses in place in schools because the teachers aren't nurses and should be not participating in taking temperatures. I think you wanted to explain a bit more about the actual structure of within the health system itself that might facilitate that, and also to respond to someone who's saying here that it has been said that students would wear masks during their commute, but not necessarily in the classroom. With the size of the classroom and size of classes, there will be no social distancing. This is of concern to me, as we know a lot of people with COVID are asymptomatic, so checking temperatures alone cannot ensure safety. I am a teacher and I have several underlying conditions. I'm not comfortable going to a class with children without masks. So what can be done in such a situation? So that's two things to follow up on there.
So I think the first one is in relation to checking the temperature and teachers not being, nurses not being trained. The Ministry of Health, we're not just leaving the teachers alone. Within the different districts for the zone, in fact, just this week last week when we were actually looking at how we're going to map out all of the schools across St. Vincent and the Grenadines, I actually put them in health districts because the Ministry of Education have their own districts, so all of the schools were covered. And interestingly, within each of the health districts, there are schools, there are health centers. So there is a response in terms of you can get some support, you can get assistance. Now, in terms of the daily assistance where a nurse or a doctor may be able to come and do that, they have their own other responsibility. But we're just asking for that sort of support. There's a polyclinic, there are the health centers who are within that zone that you can tap into for additional support and additional resources. And this is why for this week and even next week, we're going through that process of actually teaching, showing the principals and staff how to use the thermometer, what they're looking for, how to record it. And this will be in a chart form that they could keep as reminders, etc., just as they would do in the classroom when they give reminders to their students. The second question, I think, as it relates to the mask, having a child wear a mask on commute but not in the classroom. And I think we said that before as it relates to the bubble. If a teacher or a student is convinced that they can wear a mask from 8 a.m. or sometimes 7:30 until 3 p.m., and that mask needs to be changed every 3 hours, and it needs to be replaced with a fresh one. They need to wash their hands. All of that is a lot for a child, especially a child in grade 1 and grade 2. We have very serious concern with that. And it's not just for COVID. We're talking about other contaminations that could happen there. So this is why we're not recommending it. In terms of physical distancing in the classroom and in this particular setting for the bubble, as I said, we're going with the evidence that we have right now. In St. Vincent and the Grenadines, currently we have 3 active cases of COVID-19. 3 of them, all of our cases, as a matter of fact, are imported and import-related. There is no evidence of community spread or community transmission. And so when you look at the protocols from out of other Caribbean countries within the region, you would see that they have things like the staggering of classes and all of that. But you have to look at their specific context. They are evidence that there is community spread. They are trying to detect, they're trying to manage their situation. I'm not saying that we have passed it and give us a trophy or anything, but I'm saying that our context is much different. And that's the evidence that we are going with. We have done initial screening. For example, the Football Federation, they've started back their games. We screen all of them, and we've picked up no cases of COVID-19. And these are people who just actively go about their life randomly, go to their day-to-day basis, community up and about. And they're just not the only group. We have done it with several other groups, actually. So we have enough evidence, enough baseline data to show that at this point, we do not have any sort of community spread. But we're in a pandemic, so the precautionary measures are still in place.
Okay, so somebody's saying that there are a lot of loopholes in the system. Well, we don't know that yet. And I think it's important for us to understand that our health is really a shared responsibility.
Definitely.
So while a teacher might just be a teacher, that doesn't mean that they can share in the responsibility of the health of the community. Someone is asking, what about the tuck shop operators, other food vendors, and their role in preventing the spread of COVID-19 to students?
Again, as mentioned, our health is our responsibility, a shared responsibility. The protocols that obtains for teachers and students are the same protocols that would obtain for the tuck shop operators once you enter into the space, the hand washing, the temperature checks, all these protocols are supposed to be followed by anyone who enters the confined spaces of the school.
And in this particular phase as well, we're actually offering screening to teachers. I said it this week as we were doing that whole discussion. If the school is particularly interested in getting their teacher screened for COVID-19, the Ministry of Health, we can facilitate that. There is a process, and we could work out that logistics and in the official letter to the Ministry of Education, etc. But it is available. So if they are willing, that is an option. And we will continue to screen across for the safety of all Vincentians.
Well, so there's that option as well.
Yes.
So someone is saying the correct wearing and handling of masks is something that must be enforced within the schools, and not necessarily the wearing of masks, since if a child fails to wear and handle his or her mask correctly, they can contaminate themselves and others easily if they're exposed to the virus. Also, it is quite uncomfortable for a child to wear a mask before 8 to 3, with only the 2 break periods. As parents, it begins with us by ensuring our child practice proper hygiene, washing of hands properly with soap and water, etc., so that this can be transferred to the classroom. A mask with eyes exposed with dirty hands cannot stop COVID. So together, we have to make it work. Okay, and someone wants us to outline the procedure for isolation or quarantine of a student who records a significantly high temperature during checks at school, as outlined by the guidance or the guidelines of the Ministry of Education.
So what we recommend for the Ministry of Education is that once the temperature is done, you pick up anything. We have the markers, 100.1 and up, 38 and up. We ask that you place the child within a specific room or a space, an area that you have been identified that has no interaction and limit interaction. We would provide each school with a list of all the health centers, the doctors and nurses, the health nursing supervisors, the FMP, the hotline number, all of this information per school that you can contact as your first contact. Once that is done, the Ministry of Health will respond. Right as it is now, we do have COVID-19 response teams within the various districts. So if someone calls and they're experiencing X, Y, and Z, the team within that specific district closer to the individual will respond. And this is almost 24/7. They respond all hours. So once the child stays there, we ask that they put a mask on the child, allow the child to stay there. For these smaller children, we ask teachers to maintain physical distancing but stay with the child, because it may be difficult for a child to understand what's happening. So communicate with the child and stay there until the Ministry of Health can come. So once the Ministry of Health responds, we will do our initial screening. We will do testing. Once the public health team identify that this needs to be done, everyone within that immediate class, room, or space is then sent home for quarantine for at least 24 hours. And this will give us some time to actually detect. Our testing will be done in country. And once we get back the results, we will then advise accordingly.
Okay. Someone wants to know, are parents responsible for giving their children masks? Very important question. Teachers?
The PS said earlier on, it's a shared responsibility. And the Ministry of Education has engaged a number of providers in purchasing masks for students who cannot afford to buy these masks. But again, it's a shared responsibility. The safety of our children, it's our responsibility. And if we can support as a stakeholder in ensuring that our children are safe, we will welcome and appreciate that.
Because we are anticipating that there will be parents who may not be able to afford to purchase the masks. Yeah? And someone is asking, for parents who may not be able to afford several masks per day per child, a call can be made for seamstresses and tailors to donate masks to their schools.
Exactly.
And that's a very good... idea and suggestion.
Yes.
If we live by the concept that each one help one, and we apply that daily, then there should be no child without a mask to use. So again, we want to encourage parents and all stakeholders to play their role in assisting this country in combating the crippling effects of COVID-19. We all have to work together.
Most definitely.
So parents can engage their schools, because we have already been sending supplies to schools. We started on Monday and included in those packages a mask.
Okay.
So there can be that engagement with the principal and the school, so they can assist. in
Okay, so
having
most
those,
schools will in fact have,
yes.
just in case they need
Schools
to.
will have a limited
A
quantity
limited quantity.
of masks, and we're looking now to procure additional masks.
Okay. And maybe it's a good time to engage our stakeholders, whether they be in the diaspora or locally, to come forward and offer some support here, because we're going to certainly be needing them. Shanika, you've been working with the schools and doing the training, etc. How has that been going, and what exactly have you been doing where that is concerned?
So the health promotion unit, which is the health promotion officers and community health promotion officers, we have been working with the schools within the various districts. So far, the questions and comments that we've been getting are no different than what we're hearing this evening. You know, teachers are concerned that they're not nurse, and they're not doing the temperature checks, etc. There have been some concern in relation to identifying a space, quarantine holding area for the student or teacher. And I think we work through that process in saying that you don't need an actual physical room, but even if you can mark out a space, whether you have an auditorium, an assembly hall, etc., wherever it is, where you can maintain that confidentiality. So far, so good. In spite of a lot of teachers are actually getting involved, they are actually responding to the use of the thermometers and working out the plan with their schools. So what we do, we have the general protocol in place, and then we give them a worksheet, which is an action worksheet with the different subheadings that they actually can use a general guidelines as a baseline, but the reality of it, this is how it works best in my school and my setting. And I think so far, so good. We have some other schools to cover this week and into next week as well.
Okay, great. So somebody wants to know, before the resumption of physical classes for upper school students in May, the Ministry of Education promised to provide masks for teachers, but this promise was not fulfilled. Will the ministry be providing teachers with any masks for the new school term? I'll give you a chance to answer that when we come back for our final segment. Back in just a moment. Anybody in the back?
Channel 114. Channel 114. Visit you.
1 scratch card, 3 games, 16 chances to win. Win with a top prize of $125,000. Unbelievable but true. It's the new $10 scratch game. $125,000 jackpots, loaded with lots of cash prizes: $100, $1,000, $10,000, and $125,000. Get your ticket from any lotto agent or scratch runner. $125,000 jackpots. There's cash to catch with just a scratch.
Welcome back. Before the break, we were about to respond to someone who was inquiring about whether or not the Ministry of Education will in fact be providing teachers with any masks for the new school term.
During the period when the grade 6 and Form 5s were at school, the Ministry of Education did indeed supply to the schools masks to assist students who could not have afforded, and also teachers, to the extent that some schools still are in possession of some of the masks that were sent to them in May. So masks would be available. If teachers require, they can speak with their principals to have that addressed.
Okay. Someone is saying here that they can get a friend of theirs. This is someone in the diaspora to make some for about 10 kids. So the ball has started to roll. Someone is saying here that they welcome the seamstresses and tailors in the making of local masks, but it is very important to advise these persons that the making of these masks with the correct material, with filters, is of utmost importance, since the sewing of materials that cannot prevent the entry of these viral particles can be dangerous to our children if they are in an area where they can be contaminated. So I don't know if you want to re-emphasize how important this should be.
Very early when we started, we recommended that for the cloth mask, it should have at least 3 different layers. So there's the outer, there's a middle layer that you can use a filter, which is like a pellin or cotton or something, and then there's the inner part that you can use. So that 3 layer would protect, and it's washable. So you can wash it with just some warm water and soap, and then you air dry it. We do recommend that parents have that conversation with their children in terms of how do they put away their mask and how do they take it back up for use. In a video that we had recently released from the Ministry of Health, we use a Ziploc bag. Just put it in, close it, and then you can use it again depending on your level of interaction. So we're asking parents to identify which system is best for your child. In terms of when you leave home, this is what I recommend of you. When you get to school, this is what is expected of you. When you're leaving school, this is what should happen, even if it means putting some labels, etc., depending. But this is something that you're going to have with your child.
Okay. And someone is concerned as to whether there is a red zone. What set of factors will force the Ministry of Education to close a school or indeed the entire system? What is the backup if we were to come to that?
In terms of the devices.
Okay, so based on the protocols provided by the Ministry of Health, there's a list of scenarios there that would determine closure of schools. Those were communicated to the principals, so they're aware of what the protocols are. Now, if there's a situation that school closes, we're looking now at expanding our virtual learning. So currently we have a quantity of 3,000 devices on the ground. 3,000 devices is insufficient to service the entire school population, because as decided, as determined in Parliament by our policymakers, the devices are not just for students but for teachers as well. Now, there was an attempt to explore the virtual space. There were levels of success. It was a learning experience for the Ministry of Education, and we're seeing how critical it is to have devices. So another 27,000 devices is expected to be procured. We have entered the procurement process, and we anticipate that these devices will be here
Shortly. Okay.
And in addition to that, Teresa, we have also been engaging our teachers with online training, delivering online to students, and that's an ongoing process. We had Professional Development Week, which is ongoing. It started on Monday, and schools were engaged in online training. We again noted a number of challenges with that modality, and we are working towards resolving some of these issues so that if we have, because it's a fluid situation, we may just have to move to online at some point. If it becomes necessary, teachers are equipped. The Ministry of Education is ready for that.
But at what stage would that, you think we could anticipate that it would be necessary for a closure? Would be 5 cases, 10 cases?
Community transmission.
The guidelines, the recommendations by the Ministry of Health, I guess maybe Shanika can speak to.
So based on the context for St. Vincent's and the Grenadines, if we move to a phase where we have about 75% or thereabouts of our cases are actually local transmission, where there are evidence that for persons who are listening, you just pop up with COVID-19, you didn't travel, you had no interaction with anyone, all you did was go to work and then back home, etc., then the Ministry of Health will definitely recommend and advise the Ministry of Education accordingly. But like I said before, as it is now, this is what we have in this particular phase. In phase 1, 100% of our cases are imported or import-related.
Okay, someone is saying not all teachers have been or will be included in the online training. Any response to that?
The online training, it's ongoing. So teachers, outside of COVID, the skills that are necessary in the 21st century, they would be exposed to that training. The principals are working with the curriculum unit, and we hope to, at the end of the day, all teachers will be trained.
Okay, we spoke about a lot of things with regard to protocols. What can we expect in terms of psychosocial support?
So for the Ministry of Health, we have actually partnered with the Ministry of Education. Our psychosocial team from the Ministry of Health is currently working with a number of different persons. So what we did is that we used that existing structure and we partnered with the Ministry of Education, who also has their structure in place. So I think Ms. Walker can talk more about that system, where principals can directly access and utilize that mechanism.
Okay, so in the guidelines that were sent to the school, we're following a 3-strand approach in our response to psychosocial support for students. In the first strand, the assistance would be given at the school level. The second strand, the curriculum development unit would respond because we have persons there who can respond. And strand 3, we have the student support services who will assist in the response. So we have 3 different strands in our response to psychosocial support.
Okay, and then there within those strands there are specific programs.
And specific
That- the
guidelines would determine the levels at which the response would come.
Shanika, I notice you have your demonstration.
Thermometer non-touch. So I just wanted to just show that this is exactly one of the non-touch thermometers. It might not be this particular type or brand. This one was actually donated by Taiwan. Taiwan can help. But it would be a similar concept. So some will have a button here that you press, and then some will have almost like a gun that you could just pull. So with this particular one, you just remove the cover, and then you stand close, and then you press. And then it would be able to read. And that's simply. So yours is showing right now that you're at 36, but we're in AC. So all of this is what we recommend, that you try not to do it within an AC, within an AC environment. So I know a lot of persons are saying that they're not trained and they don't know how to use it. But it's a very user-friendly device, and it's something that we're willing to work with schools. So if we have not visited your school as yet, we're on our way to you. But I just wanted to just display that this is really the thermometer.
Okay, well, 16 seconds to go. I mean, it's been a long program, so more comments are in fact coming through, but really no time. Teachers wear so many hats already, from mother to counselor to police officer. Why add nursing to that list? That is already too long. And the union's press release said that we should not feel obligated to carry out temperature checks. And okay.
It's okay.
I think that's it. Are we ready for August 31st?
We are ready. School will be open on the 31st of August. With the support of all stakeholders, we are going to be successful in the execution of education to the nation's children.
Okay, that's our program for today. Thanks for joining us. Thanks to our panelists, Health Promotion Officer Shanika John, Chief Education Officer Mrs. Elizabeth Walker, Liz, and of course, the Permanent Secretary in the Ministry of Education, Myccle Burke. Thank you guys for coming along.
You're welcome.
And I
Thanks
hope
for having us.
the teachers also, teachers and listeners, took note of your discussions this evening. Thanks. See you next week.
All right. You're welcome. Thanks for having us.
Channel 114. Visit you. Channel 114.